Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Let's look into the drugs for the productive cough. So drugs under the productive cough, it includes the expectorants, that is the guaifenesin, the ammonium chloride. So there is the guaifenesin, ammonium chloride. They increase the expulsion of sputum from the lung. So increase expulsion of the sputum from the lungs. And next, looking at the mucolytics. The mucolytics is nothing but the ambroxol and the bromhexine. Ambroxol and the bromhexine, they convert the thick sputum. So thick sputum is converted into thin and watery sputum. So thick is converted into thin and watery sputum, and these drugs, they depolymerize the mucolytics, mucopolysaccharides in the sputum. Then there is a carbocysteine and the acetylcysteine. So they break the disulfide. So break the disulfide bond in the sputum. So they break the disulfide bond in the sputum and converts it into the thick sputum into the thin sputum. To learn and grow daily like this, please do subscribe.